Okay, here's my SBAR for week 6. This is Heavy D, date of birth 2/1/19XX. He's a 44-year-old male. He's a full code, no known drug allergies. He has a history of atherosclerotic heart disease, hyperlipidemia, and obesity. He came to the ER today due to shortness of air. He had a near syncopal episode. He has left-sided chest pain, and he has swelling on the left calf. He is a rapper who is divorced with 2 kids. He just recently got done with a 13-hour flight from the United Kingdom to the United States. He had shortness of air, came to the hospital. Upon assessment, I asked him his pain. His pain was an 8 out of 10. Heavy D is his vital signs are blood pressure 100/60, pulse 76, respirations of 8, temperature 99.9, and he is 95% on 4 liters of oxygen. He was on 90% on room air. There are orders to keep him titrated above 95%, so that's why he's on 4 liters. The EMS put an 18 gauge IV in his right AC. It then became occluded. We started a new IV, 20 gauge in his right forearm. So right now the labs that are important are his PTT his PT is 11.5 seconds, PTT at 20. He has a positive D dimer. His platelets are at 185. His ABGs, his pH is 7.33, HCO3 of 22, and PCO2 of 48. So right now the doctor has orders to initiate an IV, which we already did. We are on vital signs every hour. Titrate the oxygen to be at 95%. He's on strict eyes, nose, and he is also NPO. There's going to be a CT of the chest that is ordered. We are going to do diagnostic tests such as CBCs, a BMP, PTT, PT, INR, and D-dimer. Right now, Heavy D is prescribed morphine, 2 to 4 milligrams, IV push, depending on his pain. We did hold his morphine because he was at 8 respirations, so we did not get any. After we had everything set up, we called the doctor with all of our results, and basically he diagnosed him with a pulmonary embolism and deep vein thrombosis. So right now the doctor ordered him to be started on the heparin protocol. So we gave him a bolus of 3,500 units because that is the max he can go for his weight. So that ended up being 0.35 mils. After the bolus, he was then put on a heparin drip at a rate of 32 mLs per hour. So 1,600 units per hour is what he's getting. Right now, the current bag that's hanging is 500 milliliters and 25,000 units of heparin. The doctor said he would be up to address his pain shortly. Some of my recommendations for the advancement of care is to notify the doctor of any labs that continue to be abnormal or any assessments that continue to be abnormal. We want to educate the patient on pulmonary embolism, DVT, diet, the danger of sitting for long periods of time, especially on flights. I know that's a big issue just because of the elevation that they're at. We also want to notify him of talk about like a healthier lifestyle. He is a large male who is under the category of morbidly obese, so we want to try to adjust that if he's willing to take the education. That is it. Thank you.